Have you been wondering what you're supposed to do this fall when October 15th comes around during your Medicare annual enrollment period? What is this all about? Commercials, Joe Namath, Humana, tons of letters and tons of phone calls. What's it all about? Hey, this is Chris Dewey with May River Medicare, and for the last decade, I have been helping boomers and seniors navigate this complex maze that has all these special enrollment periods, penalties, different costs depending on which of the two paths you go down and what you're qualified for. So again, at May River Medicare, what we do is we educate, we empower, and we enroll our clients in the ideal option for them. So then you have access to our client services team 365 days a year. So what are we going to discuss in this video? We're going to discuss how you need to prepare for annual enrollment period. It happens every fall, what you need to do between October 15th and December 7th. We'll cover why AEP exists, what things you need to go over, what are the things you need to do to take advantage every year, to take advantage of this period, and what you can do to improve your situation, what changes you can make and what changes you cannot make during this annual election period. Be sure to stay till the end, because what we're going to do is give you an AEP checklist that'll help you stay on track. So AEP is for. So it comes around every October. You can change from an Advantage plan to a different Advantage plan. You can change from a Part D drug plan to a different Part D drug plan. If you have just the red, white, and blue original Medicare card, you can enroll in a drug plan and you can enroll in a Medicare Advantage plan if you just have the Medicare original red, white, and blue card, okay? So I repeat. Notice I haven't said anything about Medicare supplements or Medigap plans. They have absolutely nothing to do with your Medicare annual enrollment period. With Medicare supplements, you can change any time of year you want, provided you can answer a few health questions and pass underwriting, and we're going to get into that in a second. But the reason why annual enrollment exists is because every year Medicare can and does change the limits on Medicare Parts A, B, and D. They can increase their Part B and Part D premiums, as well as increase the Part A and Part B and Part D deductibles. And they can change the Part D drug plan initial coverage level, the coverage gap level, otherwise known as the donut hole, and the catastrophic level for Part D. All right, so now Medicare can make these changes to the limits for the following year. It must allow Medicare Advantage plans to change their benefits for their plans each year as well. So the big thing is these carriers can change the drugs in their formulary. For instance, you may have a brand name drug that is covered. Let's say it's a tier 3 drug for $45, and then you get your annual notice of change and you don't pay attention to it, and January comes around, and then you find out that drug's no longer on the formulary, and you have to pay $400 a month for the drug because it's not on the formulary. So biggest thing is we want to make sure your drugs are still covered. And the other thing too is doctor copays. We want to make sure that if you go to a specialist quite a bit, we want to make sure that hasn't gone from $30 jumped up to $50. Or maybe biggest thing is we want to make sure your doctors are in network. All right. We want to make sure what the maximum out of pocket for your Advantage plan is. Have the deductibles changed? Has the drug deductible changed? Because the private insurance companies can drastically change your coverage and benefits each year, Medicare gives you that window, that annual enrollment window between October 15th and December 7th. So again, because Medicare increases their deductibles, their premiums, so the insurance company can change theirs as well. So here's a few tips for AEP, big tips. On September 30th, you're going to get a letter in the mail. It's called your annual notice of change. Basically, it's going to take a look at whatever changes are occurring in the plan that you have right now to what the plan's going to be like next year. So they're going to list which drugs are dropping out of the formulary. They're going to list which new drugs are added to the formulary. They're going to show you if copays have gone up for hospital. They have to show that in the annual notice of change. It's very simple. It just shows what you currently have, what the changes are for 2022. All right. If a drug changes from a tier 3 to a tier 1, let me give you an example. A few years back, Aetna, gabapentin is a drug for neuropathy. Gabapentin was a tier 1 generic drug. It was free. If you went to CVS, it was free. Aetna moved that to a tier 3. So gabapentin, which is the generic for neuropathy, that jumped up to $45 for a 1-month supply. So we got to make sure we look at the drug tiers. Number 2, make a list of your medications. Go to Medicare.gov. Search the plans by, and again, all plans have drug restrictions. So certain drugs there's quantity limits. There are certain drugs you have to get a pre-authorization from your doctor. For instance, if it's an opioid of some sort, let our client services team handle that. We have folks that will get the pre-authorizations done for you. We have folks that are going to follow up, that are going to fax your doctor what they need to give the insurance company. We will email you all the important numbers and things that you need as well. But the big thing is make a list of those meds, go to Medicare.gov, click on Find Plan, type your zip code in, and if you put all your drugs in, and it's a little tricky, and we have software that's solid as far as finding the right drug plan. If you just want to give us a call at 843-227-6725, why do all this stuff yourself? Our services cost you nothing. And we help hundreds of folks every fall look up their doctors in the network, look up the drugs. So big thing is, too, you need to be aware with these plans. Your doctor may take the plan during the annual enrollment period, but when July comes around, for whatever reasons, they can stop taking your Medicare Advantage plan. All right? Or the hospital can stop taking it, or Humana may say, we're not working with your hospital anymore. There's no guarantees you get to keep your doctor during the year. Folks in Hilton Head know this from 2016. All right, so annual enrollment period, what you can and what you can't do. So I can tell you what you can do. You can change from Medicare Advantage to Medicare Advantage, like I said earlier, drug plan to drug plan, original Medicare to an Advantage plan, original Medicare, and added drug plan. But you know what? AEP has nothing to do with Medicare supplements and Medigap plans. You can change any time of year you want, and the best time to get a Medicare supplement is during the Medicare supplement open enrollment period, which is different than the annual enrollment period. That's a one-time shot where you have 6 months to get a Medicare supplement of your choosing, a plan that pays everything that Medicare doesn't. All right, most everything, if not everything, and basically no health questions asked. And so you have 6 months from the time you turn 65 or get your Part B to get a supplement, no health questions asked. After that 6 months, you have to go through medical underwriting. They're going to do a med check. If one of your medications is on their bad list, guess what? You don't get a Medicare supplement. You're stuck on a Medicare Advantage plan forever. All right, especially if you have a heart attack, stroke, something recent in the last 2 years. So what you want to do is you want to give us a call and let us use our underwriting software to try to find you something that's going to a supplement where you have the freedom to go to any doctor that you want to go to. So guys, click the button below, Get AEP Checklist. Included in that, we're going to email you the 20 to 21 new costs of Medicare, as well as some other articles and things that are going to help you make a educated choice, to empower you. We'll help you enroll. We'll help you find the right drug plan. But get the AEP checklist, get the free Cost of 2020 Medicare Cost brochure, and give us a call if you need our help at 843-227-6725. Like our YouTube channel so that you can be locked into all the new videos that we do over the coming months. And you guys have a great day. Bye-bye.